Why is weight restoration important? And we're going to bring it back to how that applies in patients with larger bodies and how we think about health at every size. So weight restoration, we know it's important. It's the thing that will most rapidly reverse medical complications in kids with eating disorders, and all eating disorders have restrictive components. It's the single best predictive factor against relapse. It is the only thing that will lead to resuming normal growth and development, that will lead to pubertal resumption after it's been arrested. And it does optimize brain functioning to get people back to a healthier weight. Weight suppression is something we know more about now over the last 1 to 2 decades. And basically it's the idea, when it first came out, it was the idea that there's the delta between the current weight that someone presents at and their highest premorbid weight, if they have an eating disorder, that delta, that difference between the highest place they've ever lived and where they are at when they start treatment, that's an important delta. That delta, that difference, has been shown to be, the larger it is, the more likely someone's going to be depressed, have stronger eating disorder behaviors and cognitions, be less likely to get their period back when they're done with treatment, and people with higher BMIs are more likely to have higher weight suppression even at the end of quality treatment. This has been shown to be true in bulimia, anorexia, younger and older patients. So we really try to set the bar high when we think about eating disorders and recovery. And we want people to really get well, and I'll talk about that more later. But to think about weight goals, we look at previous growth curves, and we try now to avoid thoughts of weight bias and being afraid of where someone used to be, because we want to reduce weight suppression. We want to look at their genetic potential, get their height to catch up, consider where they're at in puberty, and help them to reach a full recovery from both a pubertal perspective, a physical perspective, and a cognitive perspective. And that involves gaining weight and getting back to their true size.